Welcome back. Across the country, the debate rages on about health care. The state of Oklahoma is working on a pilot program that could ultimately cut out waste and save millions of dollars for the state. In tonight's To The Point, 2 News anchor Russ McCaskey sits down with the president of OU Tulsa to find out more.
We're with Dr. Jared Clancy with OU Tulsa. Thanks for being with us today.
You bet, Russ.
Let's talk a little bit about a pretty big announcement from Health and Human Services, and we're going to get some money. Tell us a little bit about how this program is going to work and what the money's
Sure.
for.
This program is designed to try to put together a planning process so that we can offer better care for a group of patients that right now aren't doing very well. And this group of patients are called dually eligible. They are eligible for Medicare and Medicaid. And in being eligible for Medicare and Medicaid, they are either in the lower income status and disabled, or in the lower income status and older.
Right.
And across the country, it became clear that a relatively small number of patients was costing a huge amount of money as far as providing health care for them, and they weren't doing very well as well. So lots of expense and not good clinical outcomes for their patients. Right. And so this grant focuses on trying to offer better care for them, and in doing so, hopefully lowering the cost of care for them as well.
So I guess you guys have identified that we have a substantial population to be able to do a pilot program for this?
We are. Nationally, it's about 9 million patients, cost about $350 billion. And when we started working with Medicare on this, we identified about 2,200 patients that we care for here at the University of Oklahoma that are, cost around $88 million a year in hospitalization, nursing home, medication, physician care, and wraparound services for them. And so that will be the first group that we look at. Is within that group, are there diagnostic groups that we can do better care for with different approaches? And
a lot of these people are receiving, because they're getting both Medicare and Medicaid, there's a lot of duplication, and so you're going to look at trying to limit that as much as possible?
Yeah, exactly. These patients, unfortunately, are in and out of the hospital, and they're a group that gets readmitted to the hospital on a fairly frequent basis. They are a group that's in and out of the emergency room, and so a lot of tests get redone and redone. And if they're not admitted to the same hospital or in the same emergency room, oftentimes those tests get redone, from MRIs to blood tests. It can be a whole host of tests. So that's one area of opportunity for us to lower costs. Another area that we really can lower costs is actually preventing hospitalization in the first place, by providing good case management, by providing the opportunity for them to be able to follow through with the treatment plan and helping them with their treatment plan. They don't get sick again and have to come in the emergency room.
There's 15 states that are getting the money. Oklahoma's one of them. How is it that we ended up getting some of this money to work with the program?
Oklahoma Medicaid has got a good track record in working with Medicare on innovative programs, and we were asked to help with Oklahoma Medicaid, or the Oklahoma Healthcare Authority, and write for a grant with Tulsa as a test site for this program.
Okay, and we have done some stuff like that before. We did it in the psychiatric field, is that correct?
We've done it before. We have a program here called the Impact Team, and there's now 10 teams across the state, identified individuals who were not doing well in and out of the hospital very frequently, in and out of jail very frequently with severe mental illness diagnoses, and been able to set up teams, and those teams provide care for these patients 24 hours a day while the patients are living at home. And we saw a dramatic reduction in hospitalizations. On average, they were in the hospital about 60 days a year. And after a year being in the program, they averaged 3 or 4 days a year in the hospital. And as well, a number of them, because of the mental illness, would end up in jail, and dramatic reductions in jail time as well.
So, you know, when you look at healthcare costs these days, and that is probably the biggest hot button issue across the country, how are we going to be able to cut some of these costs? It's programs like this that could eventually lead to dramatic decreases in healthcare costs across the board.
Yes, and the area that there's going to be great focus on over the next several years is called care transitions. Handoffs from hospital back to the outpatient setting with a physician, or from a physician who needs to hospitalize somebody into the hospital, from an emergency room back to a clinic. Oftentimes the handoff is not very good. The transition of care is not good. Information doesn't flow, the treatment plan doesn't flow, the patient doesn't understand what they're supposed to do, and instead the illness comes back in full force and rehospitalization is necessary.
So it's programs like this that could ultimately make a big difference for the whole country.
I think it is the key opportunity. It is the way that if we are going to be able to get a handle on health care costs, it's got to be how we organize the care for these groups of patients that just aren't doing very well right now.
Dr. Jared Clancy, thanks for being with us.
You bet, Russ.